a lot of the homeless, if they get care at a local hospital, and that's a big if they get care, a lot of times it's not the type of care we would get, and there's not a follow-up care. So some of the nurse practitioners and nurses have nursed wounds that were pretty significant.
Absolutely.
That were let out of the hospital that we would have never been let out of the hospital for, or if we were, we would have had follow-up because they said, we got to wash that, repack that injury.
Again, I mean, it's just common things that you don't think about, especially if you are fortunate enough to have health insurance right now. Health insurance is a big issue. There's a lot of things, obviously, that we have problems with healthcare and stuff like that. But in regards to I know that we were going to talk about that a little bit later. But
we can totally talk about it now. Let's move into the mental health.
The problem with the hospitalizations, going to the emergency department, is very fragmented for them. So, I've worked in the ER for years and years and years. I get it. So a patient comes in, it's the old saying, treat them and street them. That's
and if they have
do.
a prescription, how do they fill that if they're homeless?
That's not the emergency room's problem. So that's where, and I hate to sound like cold, but that's essentially it. Their goal is to get them stable and get them moving.